Good morning, everyone. My name is Lyndon, and I'm one of the ST7 registrars. It's my pleasure to have a few minutes just to give you a brief update on the progress of the Thames Valley Sustainable Operating Pathway Group and the first SUSQI initiative currently underway across the region. Last clinical governance meeting, we were reminded by Talitha that healthcare contributes around 4.4% of all global emissions, and that for the emissions that we control directly in the NHS carbon footprint, the NHS has been asked to reduce that to net zero by 2040, with an ambition to reach an 80% reduction between 2028 and 2032. So here in the UK, we've also been under the spotlight as the hosts of the COP26 conference to evaluate our action and commitment towards these goals. But within theatres, we are in a unique position of influence given that such a large proportion of the influenceable NHS carbon footprint arises from theatres, and specifically our management of anaesthetic gases makes a significant contribution to that. We know that anaesthetic gases represent around 5% of the carbon footprint for acute hospitals, with nitrous oxide contributing over 75% of this. Desflurane is the most harmful agent, with a warming effect 2,540 times greater than carbon dioxide over a period of 100 years. So we know that the nitrous oxide, for example, that we use will remain in the atmosphere for well over 100 years after we use it and continue exerting its effect. And yet, in many UK hospitals, over 90% of that nitrous oxide that we purchase is actually just lost to the atmosphere through leaking pipes rather than ever being delivered to our patients. But given that we most frequently use nitrous in obstetrics and paediatrics, it's rather sobering to think that the babies and children we care for are the least responsible for the anthropological causes of climate change, yet they're facing the greatest impact, as approximately 90% of the burden of disease attributable to climate change, either directly or indirectly, is borne by those children under 5. But this is not all doom and gloom. There are some really exciting initiatives to improve the situation at multiple levels, from infrastructure and supply to new technologies which increasingly enable us to capture, purify and recycle anaesthetic gases. And this has been recently introduced, for example, in the labour wards in Nottingham to capture the nitrous used in the labour ward. And if you haven't had a chance to see it, I'd really recommend the webinar from the Association on Sustainability in Anaesthesia and Perioperative Medicine, which goes through many of the measures that different centres are undertaking to reduce the impact of the anaesthetics that we use. So just quickly, in the next few minutes, I'm going to go through the Sustainable QI initiative, the first regional project in the Thames Valley Deanery, a quick update of our local teams and some of the future plans that we have for these projects. Thanks to everyone who came along to the launch of the Thames Valley Sustainable Operating Pathway Conference back in July. At that conference, we had, after speakers from all around the world, a vote on the first QI project for the region, and you can see that overwhelmingly the majority chose anaesthetic agent usage as our first project. And just to jog your memory, there is a national NHS target of, for example, desflurane accounting for less than 10% of anaesthetic agent carbon footprint, and the current national average is well above that. And we wanted to look at our anaesthetic usage in this region and figure out ways we can improve the situation. So data has been collected for a pre-specified time period on procurement. That includes anaesthetic vapour bottles that we've purchased, the cost of anaesthetic and the amount of propofol we've purchased, and the cost of that propofol. There's also theatre data being collected on the number of visits to theatre, as well as a survey of all the anaesthetists and ODPs on thoughts and choices around anaesthetic agents. So first and foremost, we just want to thank you to everyone who contributed and responded to the data collection and surveys. Special mention to Katharina Floss and our fantastic pharmacy team, as well as to Mark Scarf for support on getting procurement and usage data. Soren Stevenson has been coordinating the sites across the deanery, and locally at OUH we have had a coordinating project team which includes myself as well as Talitha de Vries, who's been our local lead for this project, Keelan Jerem, and also one of our surgical colleagues, Cassia Berra. But in terms of the progress of the project, since the launch in July, we've now got data collection completed in all 5 sites across the deanery, and a huge thank you to the many anaesthetic trainees, fellows and consultants who've helped to coordinate the survey data collection. The analysis of that data is now underway, and as well as getting individual breakdown by sites. So thank you to everyone who's filled in the survey, especially the free text boxes, on your thoughts, as this is really helpful in informing initiatives that are being proposed and helping us understand how gases such as nitrous oxide or DARES are currently being used in the Trust. There's plans to present the results of the overall project at a regional level so that this can be attended by all the participating sites. We're hoping to be able to submit an abstract for the Macintosh Day, and pending that being accepted, hopefully to update there. All the improvement initiatives are formulated by the local TVSOP teams and committee within the remit of the registered QI project at that site, and that will obviously take into consideration the local situation as well as the results of the survey from the anaesthetist and the teams in that place, and input from the MDT, including pharmacy. There's going to be ongoing re-evaluation as part of the QI cycle at each site. And here locally, OUH Mark Scarf has been working with the pharmacy on anaesthetic agent usage dashboard. So keep an eye out for that. And we will also be back with a site-specific update of the results at OUH on a future occasion. So in terms of the future plans for the Thames Valley Operating Pathway Group, there are plans to run between 1 and 2 sustainable QI projects per year, including some of those that were proposed and presented at the launch meeting, including group and saves for routine laparoscopic surgery, single-use versus disposable or reusable equipment, and various other initiatives, which you can find out on the TVSOP site. Also, do keep your eye open for news about a new Green Theatres monthly forum, which is hopefully starting at OUH very soon. So the anaesthetic team is the largest department in many hospitals, and as such we must acknowledge that our carbon footprint is high, but we're also in a key position to advocate for change, and it's essential at this stage really that we do look at how we work and ask how can we be doing it better. If you would like to get involved, please do contact the team to be kept in the loop. And if you're interested in finding out more from some far more knowledgeable experts than myself, do consider checking out that free association webinar and all of the talks from the Thames Valley SOP launch conference from experts, true experts with PhDs in this area, for example, and national and international speakers. They're still available for free on the TVSOP website, which you can find there. So thank you very much, and we'll look forward to giving you an update in the upcoming months.